Welcome back. All right, imagine undergoing a heart procedure and being able to return to your normal activities within a week.
My son Dax did it, but he's a superhero. And thanks to many advancements in the field, you can too now. It's a possibility for all patients. Cardiac surgeon Dr. Michael Reardon explains.
Well, the heart has 4 valves, and they control the flow of blood through the heart. The one that lets the blood out, the aortic valve, which we're talking about today, when it becomes narrow, puts a strain on the heart and can cause a risk of death of up to 1% per month when severe. This can affect hundreds of thousands of people in the U.S. and millions of people worldwide. When the aortic valve becomes severely narrowed or stenotic and you become symptomatic, if we don't replace that valve, it's a risk to you. Up until recently, the only option was open surgery, where we opened your chest, stopped your heart, and replaced the valve. Transcatheteric valve replacement allows us to go up through the leg without opening your chest and without stopping your heart. The valve we're talking about today, the Evolut valve, has a frame made out of a compressible metal called nitinol that has a quality like a spring where it'll go back to its original shape, and a tissue valve inside. This allows us to compress it small enough to go through your leg artery over a wire all the way up to replace your native aortic valve. Well, since I don't have to put you to sleep, and since I don't have to open your chest, I don't have to stop your heart, it's clearly much less invasive. It tends to be faster. We usually don't go to an ICU but to a recovery room, so you're with your family the afternoon of your procedure. You're usually home in about 2 days, and within a week you're usually back to normal activity. There's less chance of you dying during this procedure, less chance of you having a stroke, and you have less chance of kidney injury and bleeding. So it's clearly a safer procedure. Well, we started with high-risk patients, then went to intermediate, and now have tested against low-risk patients, and this valve has shown itself to be a good alternative to surgery in all risk strata. Now, the low-risk patients is the largest group of patients that have yet to be treated with this, so this opens up this as a possibility for a far larger group of patients. Well, first of all, you can go to your local physician. They should help you with this, but there's a website called YTAVR, YTAVR.com, where you can go for additional information.